Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. I hope all of you are well and fine. My name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Today in this video lecture we are going to talk about vitamin B test, overall vitamin B test. If you guys remember, we talked different vitamin B tests, like we talked vitamin B1, vitamin B2, vitamin B3, vitamin B5, vitamin B6, 7, 9, 12. Okay, so we have already talked about that. If you missed this video lecture, so you can go back to my channel and watch all vitamin B lectures. You will find it into my YouTube channel. The playlist name will be the vitamin profile. Okay, so today we are going to see vitamin B test. Now let's start the video. First of all, let's see that what we are going to talk about in this video. So in this video we are going to see that what is vitamin B, function of vitamin B, deficiency of vitamin B, main sources of vitamin B. Then we will talk about the diagnostic purpose of vitamin B test. Then we will see the test procedure, normal range, main causes of high and low vitamin B, treatment of vitamin B. Let's see that what is actually vitamin B. So vitamin B is also called as vitamin B complex, and vitamin B is actually the part of vitamins profile, means it is belong to vitamin family. Vitamin B is essential or it is non-essential, means the body can make. There are some vitamins that the body can make it, but mostly the vitamins are not made by the body. Vitamins, mostly the vitamin B are what they are, water soluble vitamins. Now let's see the types of vitamins and their normal range in the body. First we have vitamin B1, we call that thiamine, and their normal range is 2.5 to 7.5 microgram per deciliter. Vitamin B2 is called riboflavin, their normal range is 1.6 to 2.5 microgram per milliliter. Then we have vitamin B3, we call that niacin, their normal range is 0.5 to 8.45 microgram per milliliter. Then we have vitamin B5, we call that pantothenic acid, and their normal range is 12.9 to 53.1 nanogram per ml. Then we have vitamin B6, we call it pyridoxine, their normal range is 5 to 50 microgram per liter. We have vitamin B7, we also call it biotin, their normal range is 133 to 329 picomole per liter. Then we have vitamin B9, there we also call that folic acid or folate, their normal range is 14 to 51 nanogram per liter per milliliter in infant. Then finally we have vitamin B12, we also call it cobalamin, and their normal range is 160 to 950 picogram per milliliter. So these are the most important vitamins and we already talked about that. You can go back to my channel and watch all the video regarding with these vitamins. Now let's see the function of vitamin B. So the overall function of vitamin B. So first function of vitamin B, if you see in most of the video lecture I have discussed that vitamin B, if it is vitamin B1, 2 or what type of the vitamin B, so it play an important role to metabolize the protein, fats and carbohydrates. So once it is metabolized, so what will happen, it will produce energy, and energy is important for the cell to do work. Next we have that mostly all the vitamins B can maintain the normal nerve function, and if you see all the vitamins are also, vitamin B are also involved in the immunity as well, means it can boost our immunity. If you see, mostly vitamin B can maintain the sugar and cholesterol level in the blood, and vitamin B are also important in the brain development, as well as vitamin B can reduce the cholesterol level. It is also important to make the RBCs, it can make the skin healthy, and it is also important into cell division and improve the cell growth, we can say like that. Now let's see the diet rich in vitamin B. So if you see, so mostly all the vitamin B are found in spinach, meat, sunflower seed, fishes, brown rice, cheese, sweet potato, peanut, orange, egg yolk, milk, yogurt, beans like kidney beans, we have chickpeas, spinach, broccoli, almonds, banana, lentils. So these are the most important food sources in which the vitamin B are present in a large amount. Now let's see the diagnostic purpose. So mostly the vitamin B tests are mostly recommended to check the vitamin B level in the blood. If it get low, there will be the problem. If it get high, there will be also the problem. We will discuss it later. Then vitamin B tests are also performed for that purpose to check the treatment efficacy, either the treatment provided due to the high and low vitamin B, either the treatment is helpful or not. Vitamin B tests are also performed to just check the GIT related problem like celiac disease, Crohn's disease, ulcerative colitis disease, and it is also important to see the metabolic disorder. It is also important to check the nutritional deficiency as well. Now let's see the symptoms of vitamin B deficiency. If let's suppose the vitamin B get low in the body, so what type of the symptoms will appear? So it can be, we have fatigue, anemia in some of the cases. In many cases, means if you see in most of the vitamin B deficient, in most of the vitamin B, so I already discussed the anemia, that anemia are also caused in all of the vitamins. Okay, I have discussed weakness, skin issue like dermatitis, rashes, digestive issue like nausea, diarrhea, constipation, mental health symptoms like depression, anxiety, confusion. So these are the main symptoms will be appear when the vitamin B get low. Now let's see the procedure of vitamin B. So it's very simple. First of all, you need to take the blood in venous blood like in ADTA tube, red top, gel tube. So once you take the blood, so then you will centrifuge it. So the thing is that you have to know that you have to get the patient that the patient should be on fasting 12 hours. After 12 hours you take the blood. This is really important. So you must take the blood on fasting. Then what will you do? You will centrifuge it to get plasma or serum, and then you will run the test on advanced machine like fully automated advanced machine, like we have Architect, we have Mentre, we have Meglomi machine, and some we have semi-automated machine which based on FIA, fluorescence immunoassay. So in this case we have FindCare, Lofia and Digrade machine as well. So you can run the test on these machines. Now let's see the main cause of low and high vitamins. So first of all, we have main cause of low vitamin B. So it is due to poor diet, malabsorption disorder, old age, alcoholism and smoking, medication like we have metformin which are used for the glucose or diabetes in diabetes case, and antibiotics. We have chronic illness like diabetes, kidney disease, pregnancy and lactations. Now let's see the main cause of high vitamin B. So it is due to the excessive supplements of the vitamin B6, B3 and B12, due to liver disease like it can impair it or disturb the vitamin B storage and releases, due to certain cancer like we have leukemia, genetic conditions affecting also the vitamin B metabolism, fortified foods and high doses of fortified products, hyperthyroidism and other hormonal imbalance. So these are the main causes through which the vitamin B level get high in the body. Now let's see the treatment. So the treatment is that when let's suppose the vitamin B level get low, so what will you do? You will have to take all the diets that contain the vitamin B. Okay, you will have to take supplements of vitamin B like vitamin B injection for those with absorption issue, or you have to treat your sign and symptom which can appear due to the vitamin B when it get low. Then if let's suppose it get high, so you have to stop the excessive supplement of the vitamin B, and you have to treat your all the condition which are caused due to the high vitamin like liver and kidney or cancer diseases. So this is all about the vitamin B test. Thank you so much for watching. I hope you understand. I hope you like this video. If you like this video, share this videos. Also subscribe the channel to get more interesting videos like that. Thank you so much for watching.